So let's start with seborrheic dermatitis today. This is lecture number 25 of our course, certificate course in dermatology. So dermatology is the basics of eczema and some part of eczema what we have covered in the earlier class. Now from here onwards, we will be seeing seborrheic dermatitis. In the next lecture, we will be seeing atopic dermatitis and napkin rash. So let's start. So what is seborrheic dermatitis? One of the most common conditions that we'll be seeing in practice. It is also called as dandruff, seborrheic eczema, or seborrheic psoriasis. It causes scaly patches, inflamed skin, and stubborn dandruff. It usually affects the oily areas of the body, such as face. It can come all over anywhere on the face, then sides of the nose, then eyebrows, ears, eyelids, and chest, the upper torso of the body. It causes scaly patches, itching it can cause because of the inflammation. And when you scratch, you get those scales in your hand or in your nails. So this is what happens in seborrheic dermatitis. As I said, seborrheic dermatitis is also dandruff, but it can have other manifestations also other than the scalp. So it can be next to the nose, around the cheeks, around the face or mouth, or all these areas can be infested. 60 to 70% of the cases with seborrheic dermatitis have around the scalp area, around the hair area where you get these scales. It can be very confusing between frank psoriasis and seborrheic dermatitis. When we see psoriasis, we will be differentiating it between all other commonly known skin conditions, which you can confuse with seborrheic dermatitis and psoriasis. So, especially when you have the scalp and you see the lower picture here, which is very much confusing between psoriasis and seborrheic dermatitis. Usually, bleeding spots are less in seborrheic dermatitis, but there are more in psoriasis. So, what happens and why it happens? So, first we'll be seeing the physical causes behind it. So there is something called as yeast, the Malassezia yeast, which is overgrowth of yeast. What happens, which leads to your seborrheic dermatitis. Why it happens? It happens because of the overuse of some irritants like shampoo, which causes actually the overgrowth of yeast. The overgrowth produces irritants like oleic acid, which leads to production of sebaceous dermatitis. The sebaceous gland activity, because there is excessive sebum which is produced by the sebaceous glands, there is yeast growth which causes the inflammation there, irritation there, leading to dermatitis. Then there is immune response. Abnormal response leads to inflammation. It can be due to allergic reaction to a shampoo or a soap, or sometimes overuse of oil in someone. Then it produces or encourages the production of yeast there, which leads to higher immune response, leading to a cycle of sebaceous dermatitis. And then there is skin barrier dysfunction. So weaker barrier increases the irritation because of continuous scratching, continuous inflammation, and sebaceous dermatitis or seborrheic dermatitis is over a period of time, lot of men or females who come to you will be suffering from 8 years, 12 years, 10 years using anti-dandruff shampoo, using general cleansing shampoos, but not getting better. So these are the patient categories which come to us for treatment. The most common clinical features are, as I already mentioned, the most commonly affected areas are scalp, eyebrows, nasolabial folds here, chest, and the upper back. Symptoms are very common: redness, greasy or dry scaling, and very much itching. They can be very oily and greasy, remember that. What are the triggers? So triggers are usually a lot of stress, cold weather, and hormonal changes in females. Here you have to remember that every person is going to stress. So when you ask a person whether there is a lot of stress in your life, most of the people will say they have stress in life. Nobody will say, I don't have any stress in life, I'm very comfortable. Rarely you will get it. So does that mean that stress has triggered this problem? Because in skin conditions, dermatology, we will be seeing this, the stress triggers the manifestation or this skin lesion. Lot of other things, gastric problems, then there is lot of other mental problems which again are triggered by stress. But in this patient who is sitting in front of you may not be having that stress as a trigger factor. So you have to take it holistically whether stress has really caused the seborrheic dermatitis or there is something else. So ask what type of stress is there, how they are able to manage the stress, what are the other symptoms of stress they feel, and accordingly you can judge whether it's stress, it's cold weather, sometimes it is overuse of shampoo as I said, many times it is non-cleansing of shampoo after shampoo use. So men, especially in men I have seen, they use shampoo and then they have to go fast to the work. So they don't clean the scalp very well after using shampoo. That leads to many time triggers. And as I already mentioned, differential diagnosis which you have to rule out is psoriasis, atopic dermatitis, and tinea capitis. How to differentiate we'll see in the later part of the lecture. This is very irritating condition, but remember it is not contagious. It doesn't cause permanent hair loss. When a patient has come with hair loss or thinning of hair, and you also see they have seborrheic dermatitis, don't give specific medicines or constitutional medicines for hair loss. We will be covering hair loss, alopecia also later on in this certificate course. But don't take that into consideration because the hair loss, the thinning of hair is majorly due to seborrheic dermatitis. Treat it and patient feels better already and he gets hair growth automatically. So again, we will see the trigger factors. Internal trigger factors are hormonal changes, stress, and immunosuppression. External factors are cold weather, soaps, and poor hygiene. Now in soaps, again, it is harsh soaps, chemical soaps, and also when the soaps are not washed out completely. It can be hair wash, it can be face wash, where after a lot of water application also, the full soap doesn't go away from the face. Causes irritation, which leads to seborrheic dermatitis. So let's start with the homeopathic approach now. First, obvious with all the chronic conditions, we need to start with detailed case taking. Now here, even though we'll be talking about specific remedies, which I have always spoken in all the clinical conditions, which are very optimum for your treatment of seborrheic dermatitis, I usually follow up with or start with detailed case taking, especially the emotional state, the family history, the trigger factors, all these things indirectly you will come to know when you're taking a detailed case taking. Remember, as we are going ahead with the dermatology course, at the end of it, once all the skin conditions are over, I'll be taking homeopathic approach as a standardized way for all the skin conditions. How to take a detailed case, how to explore the emotional state, that will be covering as a generalized way for all the skin conditions. Obviously, that you can apply for any treatment of homeopathy. What should be the goals? The most important goal is the reduction of flare-ups, control the symptoms, and strengthen the immunity. When a patient comes to us, what is the first thing you tell the patient? You tell the patient that my prescription is going to first reduce the intensity of the flare-ups or the itching. It is going to control the symptoms or control the lesions from growing henceforth. The skin lesions are not going to grow from here as far as possible. So first thing is control it and stop it at this level. The intensity of itching, the frequency of triggers will start going down in a month or two. Then there will be reversal of the lesions, skin lesions, which will take another 2 to 3 months. And then it will be, reduction or uh, complete reduction of skin lesions, irritation, frequency, everything going to zero over a period of around 12 to 18 months. Once it goes totally, you will be kept under treatment for another 6 months so that there is no recurrence happening, and we are sure that you are completely cured of this condition. That should be your pitch when you are telling the patient. Then we have individualized treatment. As I said, the focus is on patient specific symptoms. First, giving him relief as soon as possible. Many times the patient has come to us after experiencing a lot of other symptoms or a lot of other treatments, and they have come to us probably as a last option or third option or fourth option, and they are fed up. So if you are not able to give results within the first 2 3 months, you are going to lose that patient. So all my approach in all the skin condition is such that you give results in the first, second or third month. Now, by results, I mean the patient starts understanding or feeling that the treatment from this doctor is helping me. When he feels that way, okay, slight reduction in intensity, slight reduction in frequency of the triggers affecting him, all these things helps you continue with the patient over a period of few months, when you can give results to the patient. So let's start with graphitis. Our most popular, most successful, and the most commonly effective medicine for seborrheic dermatitis is graphitis. Sticky honey-like discharge, cracks in folds. The most specific thing is honey-like discharge, sticky discharge. It is caramel looking or deep brown looking discharge what happens. Worse from warmth, washing, and better in open air. So after bath or warm water bath, they have lot of itching. They have lot of triggers which happens after taking a warm water bath. And usually they will say that once they dry up and sit under a fan, okay, they feel better. So this is the patient version of what you see in books, like worse from warmth, washing, better in open air. Here you have to compare with graphitis and sulfur. So in graphitis, you have moist eruptions. In sulfur, usually you will have dry eruptions with burning skin. In graphitis and petroleum, because again, very common remedy you will be giving is petroleum in eczema and dermatitis. So here in graphitis, you have sticky discharge, but usually you don't get such deep cracks which you see in petroleum. Then you have sulfur. Red, burning, dry skin, scaly skin, and intense kind of itching. Modalities: worse from heat, bathing, better in cool air. You compare it with Sorinum. Now here also if you see again the modalities are very similar. Worse after warm water bath or hot water bath, better when they are open under a fan sitting on bed. No, most of the time completely naked, they feel relaxed. Okay, so this is the most common thing what patient says. So once they put clothes, it scratches and they start feeling again a problem at that lesion. Then you have heat aggravation in sulfur. Sorinum is cold aggravation or cold sensitivity. Sulfur has burning relieved, hot aggravation. In arsenic. You have burning which is relieved by warmth, which you have in arsenic. Then you have Natromur. Again, you have greasy skin, you have your dandruff, already hair loss is there, so advanced stage of seborrheic dermatitis. And there is lot of emotional stress. There is lot of disappointments, usual Natromur symptoms you will be having. Modalities worse from sun, heat, stress, exposure to sun in hot, humid climate, you get this aggravation or itching feel in the scalp. Better in cool air, better in AC when working. Once they go out, they get this itchiness. Usual triggers in this are the nacromole triggers, which are disappointment, probably in love, but don't confine it to disappointment only to love. It can be any kind of disappointment, any kind of feeling, your expectations are not met. So, and that is taken very badly by them. Maybe promotion is withheld in the office or something which they are feeling bad about it, which leads to triggers and which leads to itching and other triggers of worse from sun, better in cool air. Compare them, make a picture out of it, and you get a Natromore case. So Natromore we have to differentiate from sepia is because sepia usually you will have other hormonal imbalances as a trigger factor. Other age related, like in sepia we see advanced age usually above 45, 50. Then in Natromur and Kali sulf are very specific eruptions. They have yellowish tinted eruptions everywhere, wherever there is a skin lesion. And in Natromur, there is cracked skin also will be there. Now here, there is little wrongly I have mentioned is dryness. There can be dryness or there can be greasy skin also. But there rarely you will find yellowish discoloration in Natrum muraticum. That is Kali sulf and any kind of skin lesions because Kali sulf is such a broad remedy, psoriatic, psychotic and syphilitic. There are cracks, but there is yellow scales which are there in Kali sulf. So it's yellow greasy scales, especially on head or scalp, lot of hair loss. In modalities are worse in warm, stuffy environment, humid environment, better in fresh air. So students especially who are studying, who are confined to houses which are stuffy, hot environment, especially India like tropical environment, humidity, lot of sweating, and you have these yellowish scales. You just check out the scalp of these people and you see yellowish scales and you are sure it is Kali sulf. Many doctors, especially in north of India, start their treatment of dandruff with Kali sulf low potency. They go up to giving a biochemical remedy. So the oiliness, if it is too excessive with lack of yellow coloring, okay, or yellow color for the scales, think of Tuja in such cases. Then you have pulsatilla, which have discharge, but it is not very greasy or very sticky or very, there's no yellow color discharge or no color discharge. Plain watery discharge is usually pulsatilla. Then you have arsenicum album. Dry, scaly skin with lot of burning, restlessness. According to my experience, arsenicum album works best in kids or teens up to the age of 20-22. Worse from cold at night, better with warmth. So they are the exact opposite of what we have already discussed, like Natrum Moor. They have worse in AC and they feel better when they go out in heat. So same thing what I have discussed about sulfur and arsenic. Arsenic is chilly remedy, sulfur is hot. Then in arsenic and soranum, again here in arsenic there is burning, but in soranum there will be a foul or dirty smelling eruptions on the scalp. The patient or patient's relatives, especially mother, will say that their scalp is very smelly within 1 day of taking hair bath. Very common or very effective for soranum to work in such cases. Then we have Tuja occidentalis. Oily skin, very oily. The skin is only shiny. Suppress eruptions. Sometimes you will see warts on the skin, on the neck. So these are the ruling factor for Tuja. Uh, I have seen many times Tuja has warts around the eyes also here this side. Words from damp weather. So damp weather, humid weather, Mumbai weather especially, with with you get hotness also, but with that humidity also, a damp weather, rainy season, you get Tuja remedy. Better in dry weather. Then you have most of the differentiations already now. By now you might have by heart natrum muraticum, emotional triggers. Tuja is suppress eruptions. So your own remedy going wrong, acne suppressed with your own prescription or through allopathic prescription, suppressed eruptions leading to dandruff with your oily skin, which you can see warts is a Tuja picture. Kali Sulf, already we have discussed the color of the eruptions. You should never forget it for Kali Sulf, the yellowishness which you see. Now let's see rare remedies. Rare remedies, the first one is mesothelium. Though mesothelium and petroleum are not rare as such, but usually in eczema cases, you get some remedies commonly prescribed which I mentioned earlier. Mesothelium and petroleum are cases where there is complication which arise from your or not managed well cases of seborrheic dermatitis. So such cases you require mesothelium and petroleum. Mesothelium where pus has formed and there is hard crust on top of the pus, intense itching at night is mesothelium. So hard crust with pus formation, if not treated at this time, the patient will enter into cellulitis, a complication of it. So you have to take very much care. There is a generalized swelling over the eruptions with pus formation and hard crust on it. Then you have petroleum, deep cracks, worse in cold weather. So deep cracks is one of the most common indication for petroleum for any skin condition. Soranum we already discussed, foul smelling, greasy skin, extreme cold sensitivity. Here the main point to remember always is the relative or the patient will always confirm to you is foul or very dirty smelling eruptions with greasy skin. So there is a shiny skin. When they scratch, you get the scales in the nails, which they say when they smell, they get a very dirty smell. First is soranum to be thought of. Then you have sanicula, where any of these remedies which you have mentioned and doesn't work as prescribed, or in your totality, sanicula is coming second and third, fourth. Okay, greasy skin, oily skin with dandruff. Then you have skookum chuk. Skookum chuk when nothing is helping, you don't have time, or when the patient has come to you with not a lot of details, right? And or one or two medicines what we prescribed are not helping. Okay, give this specific remedy in 3x. But I believe is most of the doctors who practice skin conditions majorly, they keep skookum chuk and oleander 30 always with them because skookum chuk is very specific for all kind of dermatitis, dandruff, atopic dermatitis. When nothing is coming up, at least it will settle the case. Then you have oleander 30. Violent itching, eruptions, bleeding, and oozing eczema on the scalp is oleander 30. So again, lot of itching is there, bleeding is there, and lot of oozing coming out of the eruptions from the scalp is very specific of oleander 30. So here as an intercurrent remedy always, more than Tuja, I like to use Streptococcinum 1M when there are many cracks, repeated recurrences, bleeding. You have been treating the case for 6 months. The treatment has helped the patient and then again increased, again helped, again increased, again helped, again increased. The patient is becoming impatient, though patient knows your medicine has worked, but it has not worked completely. Streptococcinum 1M, one dose. You can go higher after 1M, after 3 months to 10M also. Streptococcinum works very good in such cases. Then you have Sorinum 1N, excessive itching at night with complete despair. Okay, and there is other foul smell which we already discussed about Sorinum. There is despair. There is a complete in Sorinum all skin conditions. There is total despair. The patient feels that he is not going to get better with any treatment. Okay, there that is Sorinum. Then you have, yeah, now the remedy picture is over. What we had discussed earlier, some differential diagnosis with conditions which we already discussed. So, Sorinum. Sorinum will have thick silvery white scales, well demarcated plaques, commonly affecting scalp, but they also target elbows and knees where seborrheic dermatitis doesn't happen. Why in elbows and knees seborrheic dermatitis doesn't happen? Because sebaceous glands are not available there. The psoriasis scales are thicker, more adherent with bleeding spots, which I already mentioned to you when removed. Unlike the greasy scales of seborrheic dermatitis, which we are commonly call as Auspitz sign. When the scales are removed, there are multiple dots, red dots, which are indication of psoriasis. Then there is atopic dermatitis. Key features here is chronic itchy eczematous lesions often associated with history of allergy. So how to differentiate seborrheic and your atopic? All atopic. Atopic means allergy. So allergic dermatitis. Usually atopic dermatitis when we discuss later on you will experience. Nowadays it has become very common because of females using artificial gold jewelry. They get continuous eruptions at this ear level or here near the chest level here where the locket comes. Very common eruptions which you get, atopic dermatitis. Again, the atopic dermatitis, though it is not clearly mentioned in textbooks, but lot of homeopathic doctors give it the main cause as overuse of vaccines leads to atopic dermatitis. Autoimmune, it is an immune condition. It's more generalized again, covers knees, elbows, wherever sebaceous glands may not be found, also you get this dermatitis, intense itching, and seborrheic dermatitis is localized wherever there are sweat glands, whereas sebaceous areas. All the flexures, all the joint flexures is the place where you get atopic dermatitis. There is usually clear-cut indication. It can be milk, it can be gluten, it can be jewelry, it can be new soap or new cloth or new cloth material. Something is a trigger factor which leads to atopic dermatitis. Then you have tinea capitis. Again, on the scalp, mimicking dandruff. It is a fungal infection of the scalp, patchy hair loss, broken hairs, and scaling. The difference is tinea capitis often has a positive fungal culture and is present in together lot of fungus areas. But that is to be for testing. Once you test it for fungal, how to differentiate tinea capitis from sebaceous dermatitis without doing a test? Now here, what happens is in tinea capitis, usually the eruptions are localized in one area. As you can see here, it's always localized in one area, not generalized all over the scalp, which we found very commonly in seborrheic dermatitis. This tip will not be available in textbooks. This has been confirmed by few dermatologists to me. This has been confirmed by me in my practice. Tinea capitis usually you see in patches or only one patch in seborrheic dermatitis or atopic dermatitis. It is always generalized, okay, in spots everywhere. Rosacea. Rosacea, you have to differentiate when it's on the face. Persistent facial redness, papules, you have boil-like, eruptions coming up in rosacea, acne rosacea, which we call it. It lacks scaling. There is less of itching. But what happens is when we talk about acne, we usually get those big boils and you think, how to, it's very easy to differentiate. But no, when it's flattened acne rosacea, it mimics your seborrheic dermatitis. How to differentiate? There is less of scales, there is less of itching, but there is more of redness and flushing in your rosacea. Then you have contact dermatitis. Also, very often overlaps with atopic dermatitis, which I already explained to you, so you can go here fast. Is localized redness, itching, vesicles are formed due to a continuous exposure to irritants. So a clear history of exposure to irritant or allergen with sharply demarcated lesions. Okay, so it's only at the area where it has got exposed to that specific metal. Okay, that is contact dermatitis. Something is coming in the contact continuously, which leads to your dermatitis, and no other area you will get this exposed. That is your contact dermatitis. Then you have lupus erythematosus. Well-defined scaly patches, but not whitish scales you get. You get reddish scales and usually only on the sun-exposed areas. They are more scarring, photosensitive, and you have other symptomatic, systemic symptoms of lupus erythematosus. You don't have a localized skin eruptions only what you see in seborrheic dermatitis. In lupus erythematosus, also called as discoid lupus, is a systemic illness. You get other organ problems also with your lupus erythematosus. Erythematosus. The advantage of being a homeopathic doctor is rarely patients come to us directly without getting diagnosed. So, in my experience of last 20-22 years, I have rarely got a case of lupus erythematosus without getting diagnosed, and patient is coming and asking you what it is. Okay, except 2-3 cases where to start with is always confusing. But when you take a case and you take all the symptoms, you come to know it is something more than only skin lesions. And probably when we discuss, not in this course, but in a separate course of autoimmune conditions, we will discuss discoid lupus. Pityriasis versicolor. This condition is easily demarcated from seborrheic dermatitis. When we discuss vitiligo or leukoderma, this is the one because one or two of my kid patients or children patients when getting treated with vitiligo, they got superimposed or they also had pityriasis versicolor, and the parents get excited or they get aggravated to see their child having more white patches when this is self-limiting in most of the conditions by cleanliness, proper bath and drying the patches properly. Pityriasis versicolor can get better. Just improving the immunity, one dose of good constitutional or intercurrent remedy will take care of it. Primary effects again the trunk and the upper arms. There is minimal inflammation, minimal redness, minimal scaling, and minimal itching in your pityriasis versicolor. Just white patches, usually on face. You get upper body, back. Very commonly you see in kids, especially who sweat a lot, and then dry them up under a sun, sorry, under the fan. You get this pityriasis versicolor. Adjunctive management. Okay, in most of the skin conditions, we require something more than just constitutional prescription. So in this such cases, you see to it that they are in the balanced diet or start with antioxidant tablets, fish oil tablets, omega-3, which are ones, okay, some vitamins, but usually fish oil tablets are very important in many skin conditions. Then avoid your triggers, ask them to avoid alcohol, caffeine, and processed foods. Now here, when you tell them to avoid alcohol and processed foods, many times the patient are not able to stop them totally. That is the reason why I always say avoid the triggers, not stop it. Because if you ask the patient to stop it completely, patient will stop coming to you instead of stopping them. Right? So always tell them reduce it as much as possible Otherwise, continue it. Manage stress with yoga and meditation. Then you have skincare. Use mild pH balanced shampoos and cleansers. Avoid harsh chemicals and excessive washing. Don't make it dry. Dryness will aggravate the condition. So avoid harsh chemicals. Avoid, keeping up in the shampoo. Many times shampoos are written on the label, keep the shampoo for 2 minutes or 5 minutes. This is totally wrong because you cannot keep the shampoo for more time. And it dries up. Then you take a shower. That leads to your trigger factor for this, seborrheic dermatitis. Avoid harsh chemicals and excessive washing. Keep your skin moisturized. So, seborrheic dermatitis is easily manageable with specific remedies and individualized homeopathic treatment. Focus on holistic care, remedies, lifestyle changes. Ask the patient to take care of their skin. Use moisturizer which is non-medicated. Don't use coconut oil. A lot of patients use coconut oil which darkens the skin. So never ask the patient to use coconut oil at least on the face. Use plain Vaseline cream, okay, non-medicated, the only thing to use. If they cannot use it, you can ask them to use coconut oil, but warn them about it that it can darken the skin. Encourage regular follow-ups for long-term relief. So that's the basic thing. We are done with this lecture of seborrheic dermatitis today. We'll be going in next for atopic dermatitis, one of my favorite topic and one of the again very common skin condition which we see a lot in patients of all age groups. It is triggering a lot nowadays because of the autoimmune condition or autoimmune trigger which atopic dermatitis has. So that will be the lecture number 26, and the major part of dermatology course starts now because a lot of complicated conditions of psoriasis, lichen planus will start coming up now. So see you in the next lecture.